Ladies and gentlemen, my name is Emma Smith and I am the CEO of Sandpiper Communications. And on behalf of Public Relations Hong Kong, I would like to thank you for joining us at today's session. As many of you will know, PRHK exists to promote the public relations profession in Hong Kong. And we try to ensure that our clients and the wider industry are presented with best practice work and a challenge to see communications as one of the most strategic tools they have to grow and protect their business. As part of that drive, we are delighted to have been running a series of themed webinars over the past year, each aimed at discussing a different topic that is relevant for the PR and communications profession in Hong Kong, and a very timely subject if we are able to do that. And today's subject certainly meets that criteria: the challenges and opportunities for communications in combating vaccine hesitancy in Hong Kong. It does feel very timely, and I'm sure it's something that we will all have our opinions about. So a little bit of housekeeping. Today's session will run for 1 hour, and I promise that I will make sure that you are all finished and ready to go onto your next important agenda on your item today by 2 o'clock. So we are going to have a panel discussion with our panel of experts, followed hopefully by about 15 minutes of Q&A. And we do value your questions, and we're hoping that we will have some lively debate. So please, if you could send any questions in the Q&A box, which you will see at the bottom, on the bottom panel, and I will try and get through as many of those as possible. But without further ado, let me jump in. I'm honoured today to be joined by 3 very distinguished experts. And if I can start by first of all introducing Dr. Tony Leung. He is head of clinical at Cigna Hong Kong. He trained for a Bachelor of Medicine and a Bachelor of Surgery at the University of Hong Kong before joining the Hospital Authority, before moving to a role within Raffles Medical Group. And he's currently with Global Health Services Leader, Cigna, based in Hong Kong. Welcome, Tony. Rachel Blundy is a senior fact-check editor for Agence France Presse in Asia Pacific, also based in Hong Kong. She has expertise in verifying user-generated content on social media and has trained journalists in digital verification techniques as part of the Google News initiative. AFP launched its digital verification service in France in 2017 and has grown to become the leading global fact-checking organisation with dedicated journalists on the ground in a number of countries monitoring content in local languages. To do their job, they consider local cultures, languages and politics, and work with AFP's bureaus worldwide to investigate and disprove false information, focusing on items which can be harmful, impactful and manipulative. And last, but by no means least, is Professor Ben Cowling, who is currently Professor and Head of the Division of Epidemiology and Biostatistics in the School of Public Health at the University of Hong Kong. He's also co-director of the World Health Organization's Collaborative Center for Infectious Disease. He conducts research into influenza and other respiratory viruses with a focus on transmission dynamics and the effectiveness of control measures, including vaccination. Since early 2020, he has conducted research on the control of COVID-19, including being quoted in many highly cited publications, but he's also authored more than 450 peer-reviewed journal publications to date. And I'm sure you will have seen Ben in the news. He was on the BBC World Service yesterday talking about Taiwan. So we're very, very, very delighted and honoured to have all 3 of you here. So first of all, maybe Tony, I can direct a question to you. According to the latest Hong Kong government figures, only 18% of the population have received 1 dose of a COVID-19 vaccination, and that drops to 12% for both doses. Given the government has opened vaccination up to all adults, why do you think the figures are still so low?
Okay, thanks, Emma. Always good to start with a tough question. And yeah, before I dive into it, I'd like to thank PRHK for having me here today. Always an honor, and it's always great to speak alongside Professor Cowling and Rachel here. Looking forward to some insightful talk here. But getting back to your question, I think in terms of those low rates of vaccination, I think in Hong Kong here, there's a couple of overarching factors that really play into why the vaccination rate is still so low. And fundamentally, I think what we're speaking to is in the general public, they're quite concerned about the side effects or the safety of the vaccines, and that's one big thing. And secondly is a large swath of the population actually is concerned that they don't have enough information about the vaccine itself, or even, COVID, the disease process, to make the decision about getting vaccinated. And to this point, I actually refer to a recent survey that we did here at Cigna that says, 86% of individuals are quite concerned about the side effects of the vaccines as a whole. And I think that's fair enough. I mean, before I got my own vaccine, I was looking at different information sources, looking at, what kind of side effects I should expect within a 24-hour period, 48-hour period. But what's more interesting here is 42% of respondents actually said that, I don't have enough information on hand to make a decision about getting vaccinated. So I think these are the two main things here we're talking about that affects this low vaccination rate.
Thank you. So Ben, if we stick with Hong Kong, how clear do you think the communications have been around the rollout in Hong Kong? And are there areas which could be improved to help tackle hesitancy?
I think it's pretty clear. So we have vaccination centers all around Hong Kong providing the different kinds of vaccines. There's a website that people can go to sign up. Now, I know that for older people, sometimes they can't use the technology as well. So getting an appointment may require help from maybe a younger relative who can do all of that stuff with going into the system to book the appointments and whatnot. But it's actually pretty convenient to get vaccines here, and we have a choice as well. In other parts of the world, it's not so easy to get vaccines. I know people in other countries are still waiting to be eligible. In Singapore, younger people are still waiting to be eligible. In European countries as well. In Hong Kong, it's open to everyone. So it's a little bit disappointing to see that the uptake hasn't been as enthusiastic as maybe it could have been. And to add on what Dr. Leung just said, I think one of the other major factors in hesitancy would be the lack of perceived risk. So we've done so well in the past year with COVID-19. We've had up to 12,000 cases, 200 and something deaths. It's really a very small number compared to many other parts of the world. And that lack of immediate risk must be playing into it. That for people in Europe, in the US, in other parts of the world, having known their friends getting COVID, going to hospital even knowing some people that died. And in Hong Kong, we haven't seen that. I don't know anyone that's had serious illness from COVID-19. I know a couple of people that had mild infections. And so there's no immediate risk. We're not facing a life-threatening disease here because we've been doing such a good job with all the other control measures. Now, I would say in response to that those measures are not sustainable. We've done them as an emergency in the last year, but we can't keep going. We can't still think about 21-day quarantines for people arriving in 2 years' time, in 5 years' time. So the way out of it is vaccines, which we have now. We don't need to wait 5 years. We can do it now and we can get back to normal, but it's going to require a much higher uptake.
So Rachel, given all of that, what evidence have you seen of misinformation circulating in Hong Kong? And do you think that actually does play a part in this hesitancy? Or do you think, as Professor Cowling said, it's much more because of risk?
Oh yeah, so thanks so much for having me. I mean, this is really a combination of factors. It's misinformation, but it's also information that people find credible that is available in Chinese, I think. There are studies to show that there is less kind of useful and credible information available on Chinese websites. So I think the misinformation we see is a factor, but it's not the only factor. So an example of maybe a misleading kind of hoax that circulated at the beginning of this year was an image of purported victims of Bell's palsy, which is a condition when you have some sort of facial paralysis. And the claim circulating alongside this in Chinese was that the Pfizer vaccine had caused this facial paralysis. And actually, our fact checkers in Hong Kong were able to debunk that quite easily just by doing a reverse image search, which found that the image predates the pandemic. It's nothing to do with vaccines. It's just from a medical journal. It's just like a stock image of victims of Bell's palsy. So this is the kind of thing that people are seeing day to day on their social media feeds, and it causes a lot of concern, I think, and it adds to the anxiety that they may already have about getting vaccinated. It's very difficult to measure to what extent the misinformation holds people back from booking their vaccine appointment. That depends on lots of different factors, and different people will tell you, you know, one hoax affected them more than another one. But it's definitely having an impact, and you know, it's definitely prevalent here. I would say that many of the hoaxes we see circulate in Chinese, both in traditional Chinese and simplified Chinese. They're being spread worldwide. You know, it's not just Hong Kong, they're going to Taiwan, they're going to China, and then they're circulating in Chinese speaking populations around the world. So you know, this is a really global problem.
So if, as communicators, we're looking for the best and most trustworthy sources to share with our clients and external stakeholders, what sources would you recommend, Rachel? And how can we ensure that the sources that we are going to are trustworthy, and we as communicators can avoid actually sharing misinformation?
Well, I would say that we all need to find some credible mainstream media that we follow as a starting point, rather than just kind of looking for kind of obscure websites online that are not official media organizations. Then we also need to be thinking about trusted health authorities, both local and international. So obviously the World Health Organization and, you know, the health authority in whichever country you're based. I understand that people may have concerns about the WHO in terms of how their advice may have changed during the pandemic, but I think they really were reacting to a very fast changing kind of situation there. As fact checkers, we also refer to the International Fact Checking Network, and they accredit media organizations worldwide for the purposes of fact checking everything, not just coronavirus hoaxes. So I'd encourage people to go to their website, check which media organizations have been accredited, and all of the debunks that are being produced by media organizations about coronavirus are being tweeted with the hashtag coronavirus facts. So you can find those in multiple languages on Twitter, for example.
So Tony, Dr. Lung, on Saturday, the hospital authority confirmed that less than a third of its full-time workers had actually received the COVID-19 vaccine. With so many frontline healthcare staff still not vaccinated and in the wait and see group that you actually highlighted in your first reply, what information do you think needs to be shared with that group to encourage greater uptake?
Right. So I think this particular question is actually quite, or the statistic is quite surprising and interesting to me. The fact that there's a third of the hospital authority full-time employees that aren't vaccinated. And I'm going to dial this back a little bit, and in that sense, a little bit anecdotal, but even yesterday, I had a little bit of a coffee gathering with some friends who still work in the hospital authority, and of the 4 people there, all of us were vaccinated. Granted, we were all doctors, and so we necessarily have the information access and potentially more of a motivation to get the vaccination. And I think what I'm trying to get at here is when we look at the health hospital authority, aside from those frontline doctors and nurses, we're also talking about, you know, support staff, operations staff, admin staff, all of that. And so I think when I analyze that particular statistic, I'd look at it and say, fundamentally, if we take away the frontline medical workers, doctors, nurses, you've got a whole bunch of people who are not sufficiently different from the general populace in terms of how they view the pandemic or the vaccine, because these aren't the medically trained individuals. So I would say that the information that they need, the concerns that they have are quite similar to how I addressed the first question there is they have concerns about the side effects. And even though they're in that environment where they're helping deliver healthcare, perhaps the information isn't delivered in a way that's easily understandable. It empowers them to make the decision to get the vaccination. And I think that's the key. And so if I link that back to what Rachel just said, I think it's actually very important that, and I didn't know this actually, that there's media outlets that are accredited for fact checking, that it would be great if we could get them those links to the right media outlets. And on top of that, it's really about giving them the access to the relevant authorities, the Department of Health, the WHO, etc., in their local language and local context, so that they can really feel that, okay, there's a lot of work that's been done on the vaccines. It's really efficacious, and there is a need for us to get vaccinated to improve this whole pandemic situation. Because as Professor Cowling said, it's unsustainable the way we're handling it right now.
Professor Cowling, do you have anything to add to that?
Oh, no, it is concerning that healthcare workers are choosing not to get vaccinated yet. And we know that healthcare workers are not only at risk of an increased risk of COVID, particularly if they work with infectious disease patients, work in the general wards where there could be a COVID case coming in. But if they were to get COVID and they didn't know about it, they could also pass it on to vulnerable patients. And that's really not ideal. So in the future, I think there will probably be a lot more encouragement for healthcare workers to get vaccinated, especially if there's not a lot of enthusiasm right now. I think that's something that will have to change. And that must be one of the things that's playing into the hesitancy here, that if doctors and nurses appear to be concerned about getting vaccinated, then I can understand why other people might be concerned as well.
Yeah, I think we all can. I think the key really is to start to think how we can communicate. Local language is one, communicating with facts is another, but it would be great if we could see that the frontline workers, for example, started to increase the amount of frontline workers actually getting the vaccine. Those type of messages going out, I think, might actually persuade people. So, Professor Cowling, do you think we're missing any potential opportunities to educate the general public more around the vaccine?
I think that because of the current maybe lower level of trust in official sources in Hong Kong, it's going to be critical to try and use informal sources, social media, peer groups. But I don't know how to achieve that, how to maybe promote the truthful messages about vaccination on social media, because I know there's a lot of people get a lot of influence now from social media, more so than from official sources. And so I don't have a solution, but I think that social media's got to be a big part of it.
So Rachel, how big a role do you think social media has played in this misinformation?
It's predominantly being shared on social media, this misinformation. So something will start on Facebook and then it will migrate to WeChat or Weibo or vice versa. And people have a habit of sharing things based on their emotional reaction. They don't tend to think twice about sharing. And this is the major problem that we see. I don't think all of the misinformation that is spreading is being shared maliciously. And I think often it's just people kind of having that emotional feeling that they're concerned about something. They want to help their family and friends. It might be with the best intentions, but actually they haven't done the basic checks, like what's the source of this text, or what is the source of this image or video, where was it taken, and what does it refer to, what's the context. All of these questions should be the first things that you ask when you receive something on social media. And I think awareness of this is improving, not just in Hong Kong, but globally. The term misinformation, and sadly the term fake news, which I don't like so much, misinformation has become much better understood globally, and it's not a new concept, but the way it accelerates on social media is relatively new. So at least people are becoming better informed. But I think the biggest thing I've seen during COVID, not just in Hong Kong, but is globally, where people tend to think that they can do their own research and they can go down the rabbit hole and find all these different YouTube videos telling them things that they already want to hear, and then they show them to their friends and say, oh look, this is what so and so said, it must be true. And that's really concerning, because we're not experts. We should be speaking to the experts and we should be referring to the officials, but this is part of a wider problem in the world at the moment where there's a lack of trust in official sources.
And maybe I can ask, maybe Ben can answer this, but what populations and age groups do you think are most susceptible to this type of misinformation?
So on social media, it would definitely be the younger, the unages rather than the older age groups. But I don't know where the older adults are getting their information from. I don't know. Yeah, there's definitely going to be a divide in society between people of different persuasions, different ages, different characteristics. So dealing with misinformation on Facebook or social media would help with younger adults, but we also have a really low vaccine coverage in older adults. I think it's below 5% in over 80s. And that's going to be a major problem if we have a resurgence in COVID, because that's where the COVID hits the hardest. That's where the most serious infections occur. And I think 95% of our COVID deaths have been in over 60s. So the older adults are really a priority group, and they're not choosing to get vaccinated.
If I could just interject on that one, sorry. I think that although older people are not always on, traditional social media platforms, I think a lot of them are receiving messages via WhatsApp or WeChat, and so those adults become very vulnerable to the misinformation because they don't always have the first-hand experience of fact-checking online. And so what we tend to see is, although younger people might be more active on social media, it's often older populations that are more guilty of spreading it because they're not sure how to fact check it. We're actually finding that younger adults are increasingly better informed about how to fact check, and then it's their parents and maybe even their grandparents who are not sure how to do that.
Tony, do you have a view, especially how we could actually try and convince older populations to change their view?
Sure, yes. Actually, I was thinking there, because if I relate this back to my own practice, which I'm a practicing GP, is a lot of times I did see patients coming in with, showing me a WeChat or a WhatsApp, and these are older individuals, and saying, oh, is this true? And so I think to address that, one of the things that potentially we as healthcare providers can have is it's actually the GPs, and have them in a consult room when the individuals are coming in, address this misinformation and the questions that these individuals have about the vaccine or even COVID itself. And once again, the survey that we did actually pegged healthcare providers and GP in the eyes of the respondent as the most reliable source of information. So it would also be about getting this outreach and encouraging people to go and ask their family doctors or their GPs about their specific concerns, and that would definitely help in combating this information.
And how do we think this impacts, the younger family generations? Because if the older people aren't being vaccinated, surely that will have an impact on younger. I mean, so many people I speak to just tell me they're just having a wait and see, sort of philosophy on this. Oh, I'll wait for the second generation vaccine to be released. And it's very difficult sometimes to convince people when you feel so strongly yourself that is not the right attitude, that their attitude is wrong. I'm just wondering how you feel that we could actually do this, how we could help.
That is a tough question. I think in my personal experience, getting the vaccination within my own family group and within my circle of friends that are not medically trained, I think I encountered the same problem that you've actually pointed out right now. Is there's a large number of people who tell me, well, I understand we should get the vaccination in the long-term planning, but let's wait and see. We don't know what the side effects are like. I don't know if there's going to be any serious complications due to it. And so, well, since you've gotten the vaccine, why don't you tell me in 2 months' time whether this is a good vaccine to take. And so it's tough, but I think the main approach here really becomes a public health thing, where we've got our medical frontline workers really spreading the message about how useful and how efficacious this is, but also we need some sort of campaign to really drive this home and help people understand, you know, what the vaccines that are available, they have gone through stringent processes. They are proven to have a certain level of protection, and this is what's ultimately going to lead us out of this pandemic in an unsustainable way, that we're, you know, closing borders, we're not able to visit our relatives overseas, et cetera, et cetera.
So if we talk about the fact that maybe we should, you know, there should be a campaign, right? There should be a Hong Kong-wide campaign. How could we work with media to actually help try and drive the uptake of the vaccine? Rachel, how do you think we could work with media?
I think it's a real challenge. I can see someone is already asking about how media outlets in Hong Kong have been reporting the vaccine drive and various cases that have been investigated, you know, over fears that there could have been adverse reactions to the vaccines. And actually all of these cases, that they've found that there was no conclusive evidence of any link between the adverse reaction and the vaccine. And I think this is a real problem. I've seen it just on my way to work, you know, on the TV, on the MTR, you know, people reporting one person has been taken to hospital after receiving the Pfizer jab, but then they don't follow up. And that's a real concern, because people just see that initial headline and they don't necessarily know what happened to that person. I think it's problematic when you get government initiatives designed to educate the media or designed to tell the media what to do. I think that's problematic in a free society. So I think maybe this needs to come from a separate entity like the Hong Kong Journalists Association or an NGO or someone independent, or, you know, editors of the main outlets in Hong Kong maybe need to put their heads together and think this through a bit more. But I don't think pressure from the government would work in this instance. And I think the public would not be inclined to support local media who just followed the kind of bidding of the government on this. Yeah.
I mean, we've already got some questions coming through. One of them is, why has there not been a requirement for frontline workers to be vaccinated? Professor Cowling, can you answer that? Because I was actually quite shocked when I went to have my second vaccine and found the person who was injecting me had not been vaccinated themselves.
These vaccines are approved under emergency approvals. So that's true in Hong Kong and in many other parts of the world. So in general, it's better if people can choose whether to take them or not, rather than them being required to take them because of the approval process being done as an emergency approval, different to the usual approval process for vaccines. And it is an emergency. So it's right to have an emergency approval process that's quicker and more efficient. But if you require people to take a vaccine that's approved under those circumstances, it's not ideal. So I understand right now why that's not the case. But if the uptake stays low, then I would imagine mandatory vaccination could come into play. And in Hong Kong, we do have mandatory vaccination, I think, for a couple of other vaccines for healthcare workers, maybe hepatitis. Dr. Lung may have to have it in his head, the exact ones. And in other countries, there's mandatory vaccination for healthcare workers for some conditions as well. So maybe if the vaccines were to get the full approval through the ordinary process, which takes a little bit longer, at that point, that might be a good opportunity then to make it a requirement for re-registration of healthcare workers that they have to be vaccinated the same way as for hepatitis. Right, Dr. Lang?
Yeah, correct. So I think when we talk about the vaccinations, and I think there's also something coming up on the chat there about different people, different demographics with different pre-existing conditions and how they stand in terms of getting the vaccination. Is there an increased risk profile? At the end of the day, I think this is always about that risk analysis, is looking at the patient and looking at whether there is a benefit in the long run or even in the short term to taking the vaccination. So we do need to some extent more information to make very informed decisions regarding the approval process, etc., that Professor Cowling is referring to. But in context, I mean, we're looking at this from entire population level, and we're also looking at this from protecting individuals as well as groups. Then by and large, we need a larger proportion of the individuals to get vaccinated. And even if there's high risk demographics that shouldn't receive the vaccine, everybody else should. And so by definition, they would be extending protection to the high risk groups. So these are the things that we really need to communicate out there so people understand what this whole drive is about.
We've had two questions. One is from Kiri and one is from Helena that both touch on the same thing. So let me just read them. But which local group in Hong Kong do you think has the potential to influence the wait and see group to get vaccinated? For example, business leaders, celebrities, well-known medical professionals, government, etc. That's from Kiri. And then Helena says, in the UK, much loved figures like the Queen and David Attenborough have been vaccinated. Why doesn't the Hong Kong government find similarly respected people to promote vaccination? And they're both very good questions. Who would like to have a go at answering those first? And are any of you celebrities enough that you want to put yourself front and center of a campaign?
So I think that the well-known medical professionals have got vaccinated. The main experts that you see on TV talking about COVID, they have been vaccinated in the early days, actually. Now, I just saw the other day that the government started taking vaccine to businesses. I saw on the news that there was one major business that had vaccine brought in to their office. And I wonder whether having the CEOs of those businesses up first in front of everybody would be an encouragement to the junior staff that it's fine to get vaccinated because the CEO just went for it. So that would be a good part for that particular strategy of taking vaccine to businesses and to offices. And then the one I haven't seen so much in the media, but maybe I've missed it, are the celebrities. I'm not aware that a lot of celebrities have signed up and talked about how it's important to get vaccinated and they've done it and so on.
Rachel, what do you think?
Yeah, I agree with Ben. I think that one of the biggest problems here is that it's become intensely political. So celebrities are reluctant, probably, even if they have received a vaccine, they're reluctant to declare that because it might be seen as promoting the government's cause. And obviously the backdrop to this whole vaccine drive is that we had, 12 or 14 months of consecutive protests that were, very, very kind of intense for Hong Kong, and it provoked a huge public reaction. So I think, unfortunately, it's going to take some traditionally more pro-democracy leaning people to potentially be more open and say, yeah, I had the vaccine, I wanted to protect myself and my family. This is not about politics. This is just about good health practices. And it might take that before others decide that they can trust the system and go ahead and get vaccinated.
Dr. Leung, picking up on a couple of those points, we're seeing more and more people returning to the office in Hong Kong. What role do you think employers have to play in communicating information about the vaccine to their workforce and encouraging a greater uptake of the vaccine?
Well, I think it comes down to the informational aspect. It's really about providing the access to the right information in a very accessible space for these individuals to take a look at. An example is really here at Cigna, we have our repository on our internal drives. We also have hosted webinars across the regions, led by the respected figures in our organization to get the information and the message out. So I think, not to say that we're perfect, but the idea is I think organizations have that role to play, is providing that safe space where the information is accredited, it's fact checked, it's the right links to the right health authorities so that people can go and make that informed choice. And right now, that is exactly what this is. It's a choice about whether to get vaccinated, and so the information just needs to be accessible. So organizations can definitely do that. I mean, we all have our internal drives and networks, and if you provide that readily for the staff, I think it's the best thing you can do. And making sure that people who are in leadership positions try to give that message out that, you know, this is something that we're looking at, and we really encourage you to get the facts right.
Christine Houston has asked a question about whether the government has seriously considered having monetary benefits, i.e. a financial payment to those vaccinated, and or excluding those not vaccinated from any future government payout or sweetener. I think many of us would have seen, I think it was Michigan, but I could be wrong, but the state in the US that had a $1 million, right, just randomly, I guess, drawn from people who were being vaccinated. And, you know, the governor just came out and said it is much cheaper than us keeping basically our economy closed. And I think that goes back to Professor Cowling's point, which is that we can't carry on like this for the next 5 or 10 years. So do you think that is something that potentially could unlock what seems to be just a situation which doesn't seem to be going anywhere? What do you think, Professor Cowling?
Yeah, sure. I think we need something to change, because in the current trajectory, we're not going to get to a particularly high vaccine coverage, certainly not high enough to think about getting back to normal. So that the things that would have to change is dependent on what the government decides to do to change the situation, I think, unless there's something comes out of the blue from celebrities or whatever that changes the momentum. For the government, there's carrots and sticks. So financial payments is a choice of carrot. There's others as well. We've heard about the reduction in quarantines for vaccinated people. Maybe there's other options as well in terms of incentives and relaxations of policies for vaccinated people. At the same time, there's sticks. And so there's the mandatory vaccination potential for domestic helpers that was raised before. We've talked about for healthcare workers. And maybe for other groups as well. So that would be a form of stick. So I think right now the ball's in the government's court to think about carrots. I would prefer to see carrots rather than sticks. For financial incentives specifically, I think it sets a precedent, and I'm not sure we always want to be paying people to get vaccinated, because the vaccine is something that's for the person's good anyway. But paying them makes it seem like it's maybe not, and you only do it if you pay me. If there's other measures like the relaxation of quarantines that are evidence-based, then I think that may be a better precedent to set, put it that way.
Dr. Lowe?
Sorry, I pressed the raise hand button by mistake there.
Well, we've had another question here which says, as Professor Ben Cowling and the many media have said, this vaccine has been approved because of an emergency situation. Does this mean the current vaccines are not completely safe because they haven't been tested, or at least not tested as it should be? And then
I can address that.
Yeah, because the doctors are actually the first to say no.
I can address that. So for typically for vaccines, they'll go through a long development process that takes years and years with a number of different types of trials. At the beginning, just a small trial to make sure the vaccine's doing what you think it should do, then a slightly larger trial to make sure that there's a good immune response and there's not too many side effects, and then a larger, what's called phase 3. So that's 1 and then 2 and then phase 3. Phase 3 is a really large one to prove the vaccine actually works against the disease, and those involve tens of thousands of people, often followed for quite a long period of time. For COVID, that's all been compressed together. The phase 2 have started before the phase 1's finished. The phase 3 started before the phase 2's finished, and everything's been kind of completed in a very short space of time. But the phase 3 trials that were set up to test these vaccines, whether it's BioNTech, Sinovac, or the others, are typically designed with about a year or even 2 years of follow-up. And what's happened now is that the companies have had a look at the data after, say, 3 months, and it's already very clear that it works, but the trial's intended to go on for a year. So then, according to at least for the FDA in the United States, according to the rules, they should really finish that trial before they can apply for the full approval. But with the interim results after just maybe 3 months, when it's very, very clear that the vaccine works very well and it's very safe in those first 3 months, then they can say, okay, we'll give you an emergency approval because we really want to get this vaccine out into the community, get people vaccinated more quickly. We don't want to wait another 9 or 12 months for that to happen. But there's different rules and regulations about vaccines that are approved in this emergency process. And in Hong Kong, the emergency approval is given by Sophia Chan, by the Secretary for Food and Health. It's not done in the usual way by the Drug Office of the Department of Health. So it's her call to approve those vaccines, advised by an advisory committee. And I think there's some differences in the vaccine companies. I don't know how exactly the vaccines come in and are used and are distributed in Hong Kong. But in terms of the concern about safety, there's really no concern. We've seen already the vaccine administered to tens of thousands of people in those clinical trials with no issues. And in places like Israel, they've done tens of millions, I think, of doses with no real serious problems identified. There's, of course, the mild reactions, the fever, the tiredness after the vaccine. There's occasionally some events which take place after vaccination, medical events, heart attacks, whatever. But when we compare the rates of those with the baseline rates in the general community, they really don't seem to be different. So no concerns raised after tens of millions of people have received these vaccines. We're not going first in Hong Kong. Lots and lots of other people have had the vaccines already. And there's really nothing to worry about in terms of the safety, in my opinion. So the question bounced up immediately, why doctors and nurses say no, thank you. I don't know. It's really a concern to me about why they don't want to get vaccinated. I would like to ask them as well. I don't think they're anti-vaccination. I think maybe they're just hesitant. Maybe they're just waiting, but maybe Dr. Leung has asked his friends or colleagues why they don't want to get vaccinated.
Yeah, actually, that's interesting to me, because quite honestly, the circle that I'm in, the doctors that I communicate with, the nurses that I do communicate with, by and large, we're all vaccinated. And so I wonder if even that particular bit of the majority, let's say, that information that comes out that lots of doctors aren't getting vaccinated, I wonder whether we need to check that fact to make sure that, look, we're passing the right message out. Because from my experience here, actually, is most people that I do work with, communicate with on a daily basis, have been vaccinated, the frontline medical workers.
There's a question as well which says, in that case, should we push people to take the first gen vaccine or put efforts to persuade people that they should get the second generation?
I don't know what the second generation vaccine might be. I haven't heard of anything in the pipeline that's going to be better than what we already have. BioNTech, 95% effective. It's going to be very difficult for any vaccine to beat that, actually, to get above 95%. I've heard about vaccines that combine COVID with flu for some time in the future, but those won't necessarily be more effective against COVID. So I feel like BioNTech particularly is already about as good as it's going to get. And so there's no reason to wait for a future vaccine that might be better, because I can't envisage what's that kind of vaccine would be like.
Yeah, so I do agree with the idea that, there's no real need to wait for a second generation. In fact, I don't quite wrap my head around what that means in terms of second generation vaccine. You're talking about the same types of technologies, you're talking about the same types of processes here. So it's really just about making that decision on whether you want to get vaccinated. And quite frankly, if the decision point becomes you want to get vaccinated, the earlier the better.
Well, let's just move this slightly to Taiwan. We've seen the situation in Taiwan deteriorating. I know, Professor Cowan, you were talking about this on the BBC yesterday. But Taiwan only has a vaccination rate of around 1%, and many are now scrambling to get vaccinated after months and months of not having a single local case. What lessons do you think Hong Kong could take and learn from that situation? So
I think it's really an important illustration for us that the strategy we're doing now of elimination is not sustainable. Like Taiwan had 0 cases for a long time, then suddenly the cases flare up, and it's going to be tough for them to get the current outbreaks under control. I expect they can do it, but it's going to be tough, and it's going to take some time. So in Hong Kong, I think there's this imagination that we can get to 0, we can have a bubble with the mainland, and then we'll start having travel with the mainland and trade with the mainland, and inside Hong Kong, we'll be kind of getting back to normal. I don't think that's going to pan out. I don't think it's going to happen like that, because on either side, either here or in the mainland, the virus is going to get back in, like we've seen in Singapore, like we've seen just now in Taiwan, It's going to be back sooner or later, and it's going to burst any kind of bubble like that. And it's just totally unpredictable. It's not sustainable in the long term. It's not even sustainable in the next year. So I feel like it's much better for Hong Kong to get the vaccine coverage up to a higher level, because then we don't need to worry about COVID anymore. And actually in the mainland, I was caught by surprise, because I Googled yesterday, and they administered 100 million vaccines in the last 10 days. So they jumped from 20 to 25% or something, first dose, in the last 10 days. If they keep going, or if they accelerate even beyond that, then they'll leave Hong Kong behind. They'll be up to 50, 60% vaccine coverage within a few months. And then all of a sudden in the mainland, they can open up again. And we'll be stuck in Hong Kong as the only place in the world that can't afford to open up because it's too dangerous, because COVID poses too much of a threat. So it's really not sustainable. That's what I get out of the situation in Taiwan right now. It's not sustainable for Hong Kong to go down this path.
Rachel, Tony, do you have a view?
Yeah, I was just going to say that I think it's really interesting speaking to people here. They seem to have a sort of perception that we are perhaps developing some sort of immunity to the virus, or they think that because we are a very hygienic place that maybe, you know, we're just less likely to get the virus here. And there's lots of people, this is not just on social media, this is just in general conversation, that tell me things that they believe based on no real scientific fact, and they just think that we will be fine because somehow Hong Kong has some sort of inbuilt resilience to this virus. And I think the situation in Taiwan proves that that's not true. If you don't start to vaccinate a large proportion of your population, then you will not be properly protected, and this virus can get in at any point. And this kind of ongoing exercise to reach COVID zero, we're just going to keep going in and out of restrictions for a very long time if we don't vaccinate enough people. So I just find that really interesting, that people kind of make up their own science and they kind of believe things based on their gut reaction, but it's not based on anything that's actually tangible.
Yeah, and I mean, look, a big part of that has to be because there isn't the right information filling that vacuum, right? So that's one of the first things maybe we could try and rectify.
I think that's true. Yeah, I think sometimes, certainly one of my friends, Masato Kajimoto at the Hong Kong University, he's done an extensive research on the levels of credible information available on vaccines. And, you know, we take for granted as English speakers, you know, that we can get everything we need, we can find trusted sources, but actually he's done research which does really show that there's a real lack of that credible information in Chinese. And if people are a bit mistrustful of certain authorities, then we need to, you know, put this information out on via channels that they do trust, to reach them a different way. So that is definitely something that we're lacking in Hong Kong.
Well, you know, perhaps it's just my own perception, because I'm only reading English language press, but what you've just said, I think, might back up what my feelings, which is that I just don't see any moves by the government to try and up the vaccination rates. Instead, all I see is very reactive things like dealing with spot outbreaks, mandating 21-day quarantines, and then lots of flick-flacking between whether you have to go to Penny's Bay and stay in your home or whatever. It's just not very clear. Do you see any actions being taken that some of us are not aware of? And this is really a question for all of you. Am I missing something?
There is now the scheme to go into businesses, which is a new strategy. I think that's good, and I think that's going to help at least with the business community. I'm still waiting to hear about the plan for elderly homes, because so far my understanding is that elderly homes really haven't received vaccinations, and that's actually slightly shocking, because we know in other countries they're the first of the first. The very first group that gets vaccinated are elderly homes, because they're really the highest risk setting for COVID. And in Hong Kong, that hasn't happened so far. I hope that's going to happen soon, because they really are at risk if we're going to have a resurgence sooner or later. And then other groups like the refugees, I've heard discussion in the media, the long stay, non-residents, and also people in other institutions, in prisons, for example, and detention centers, those are also, we've seen in Thailand, thousands of cases in prisons just very recently. If the virus gets in, then it can spread very, very quickly. And I think the vaccine should be offered to prisoners and people in other institutions as well. And I haven't seen that yet. So I agree with the comment that there hasn't been that much proactive effort so far to go into the community. There's been the vaccine centers, and you have to book the appointment and go there and whatever. But there hasn't been beyond that, there hasn't been maybe enough effort yet. And hopefully that's changing now.
Anybody like to add to that? No? Well, we have another question. Is there anything that pharmaceutical companies could do in order to improve vaccine confidence? Maybe Ben, do you have a view on that?
It's difficult because I mean the companies are making and selling the vaccines to Hong Kong and to other places as well. I don't know if they're in the best position to for example present data on how effective their vaccines are, how safe they are, because of course that's the business talking. I think independent groups would have more credibility, and it's important that in Hong Kong we are assessing the vaccines. In Hong Kong, we're looking at that. The Department of Health is monitoring it as well. Chinese University are looking at it as well. So we have, and we're collecting a lot of data on that we'll release, but it takes time. And so, for example, for the effectiveness of the vaccines, we can't judge that in Hong Kong right now because we don't have any COVID. So I can't say, you know, like we've heard in the news in Israel, it's 90-something% effective in real life. We can't have a real life estimate for Hong Kong because there's no COVID about right now, which is good. But that means that we're lacking that local effectiveness to say that, look, at among all the cases, there's very, very few among vaccinated people. And they have that data in other countries where they have a lot of vaccination and a lot of COVID. And I think that makes a big difference when you can say that not only did the clinical trials show that it's highly effective, but in real life, people that have got vaccinated are really, really highly protected.
If I could just add something on that point, Emma, I think that what we see in the misinformation space is that when pharmaceutical companies and vaccine developers put out information about their product, it's often misunderstood because it's quite complex and people are kind of reaching around trying to digest it, and they often pick out the wrong parts of the press release and then they recirculate it on social media with a false claim. So I think pharmaceutical companies and vaccine developers, they can only do so much, actually, unfortunately. And the trouble with the internet is that people often are reading things that they haven't, you know, just studied at university, so they can't fully digest it. And we need these kinds of studies presented in a much more simple layman's terms for people to digest them.
Yeah, absolutely. What about if the pharmaceutical groups would work with community groups in order to build confidence? Do we think that could be one way of trying to sort of break this impasse? Anybody have a view on that? No? Okay. Well, I've got another question here from Christine to all panelists. How can it be that non-vaccinated persons are not permitted to go into bars, but non-vaccinated frontline workers are permitted to go into hospitals and government-run vaccination centres?
The thing about clean zones and dirty zones has never really made sense to me, because as a vaccinated person, I'm really not scared of unvaccinated people. Actually, I'm not scared of COVID anymore. I'd be quite happy without a mask going anywhere in Hong Kong, into a crowded place, whatever, because I'm personally no longer scared of COVID. I don't need to live in a clean bubble because COVID doesn't threaten me anymore. And I don't think I'm much of a threat to other people that are not vaccinated either. So if I was to go on the MTR without a mask, I wouldn't be posing a risk to the other people around me because I've been vaccinated and the vaccine works. So I'm a little bit perplexed by this idea of promoting clean bubbles for vaccinated people, because actually vaccinated people don't need that. The only people that need the bubbles are maybe the unvaccinated people. There's been a lot of discussion about the idea of vaccine passports in Israel. They were used very successfully to get vaccine coverage up to a high level. They're not ideal as a policy because of the possible inequalities. Some people can't get vaccinated, and some people really just don't want to get vaccinated, and it's not always fair to have passports for the long term. But in the short term, that's effectively what the bar policy is, saying that you can only go in the bar if you've got a vaccine passport, and we may see those being used for other settings in the future. I don't know about healthcare settings, but it's one of the maybe carrots or sticks that the government could think about.
Yeah, but I've had a lot of people say to me that they don't intend to travel anywhere, therefore they don't see why they should be vaccinated. And I think that even with the passport, even just the name of that just makes it sound as if you would only need it if you were going to travel. But I mean, the EU, I believe, is going to announce this week some measures around passports, but I can't imagine Hong Kong would make the cut, would be on anybody's list with such a
no, it's not a physical thing, it's more the concept. It's more the concept that if you've been vaccinated, then you have a pass, so you can go to the bars, or you can go to other public facilities, or if you're a doctor and there's a vaccine passport, then you can access the hospital, that kind of thing. So that's the concept of the vaccine passport. It's just a shorthand for saying there's special measures for vaccinated people, and unvaccinated people have to be more careful because they're at risk of getting COVID and passing on COVID to other people as well. So I think the travel one is a special case. The travel one is a special case. And for places that are going for elimination, like Hong Kong, actually is risky to allow people in even if they've been vaccinated, without a quarantine, because there is still that tiny chance that they could be infected and then bring infection into the community and burst the bubble, burst the zero COVID. But at the same time, if that works as an incentive for people to get vaccinated, to get the vaccine coverage up another 10 percentage points, then that would offset the kind of risk that you'd see from the virus coming in. And the virus is going to come in sooner or later anyway. So I'd actually support the use of on arrival vaccine passports, so the vaccinated people don't need to go into quarantine when they arrive, because it's really not fair to them. They've gone to get vaccinated. They've done the best they can to help Hong Kong to get back to normal. They really don't pose much of a risk to the community. And I think really the urgent priority now is to get vaccine coverage up to a higher level.
Yeah, I mean, yesterday the SCNP ran a letter suggesting that by making life more convenient for those who are fully vaccinated, it would encourage greater uptake by those who are still hesitant. What do you think the most effective incentives would be for the Hong Kong public? If we don't think people will actually want to travel, people won't travel as much for business. I'm just wondering how we could make people more likely to respond to incentives or restrictions.
I mean, this is just anecdotal, but I actually think that travel incentives would be the biggest thing amongst people I speak to. So that's the number one thing that people tell me, that, they want to go to Japan, they want to go to Taiwan. They're not so fussed about Singapore, ironically, given all of the conversations about travel bubble. But, if they were told you can never go to Japan in the next 5 years, or that would be serious. And I think that might push people to go ahead and do it.
Yeah. And then one last question, which just came through from Kiri, which, where is it? Let me find her question. I think it was around, if we look for a pass rather than a passport, how could we actually make that happen?
Well, the government's already started it with bars, but that can be expanded to other things. But the problem is, with a very low vaccine coverage, it's difficult to start that, for example, for restaurants, because the market wouldn't be there, just as it's not there for bars, because such a low proportion of people have been vaccinated so far. But you could have a plan in place to say that by September, if the older kids have been vaccinated, if the teachers have been vaccinated, then schools can be fully open, and children who haven't then still have to wear masks, that kind of thing. You can just have a lot of policies that differ based on whether someone's been vaccinated or not. And it's evidence-based, because if you haven't been vaccinated, you need to protect yourself in other ways. So, for example, you need to wear a mask if you haven't been vaccinated. And if you have been vaccinated, you don't need to anymore, because you're protected by the vaccine instead. So it just needs a plan in place and then an announcement and a timescale.
Yeah, and I have to say that given how hot Hong Kong is at the moment, and just imagine what it's going to be like in July and August, any incentive surely to not have to wear a mask in that heat, I would think we'll get quite a lot of uptake. So we're 1 minute past 2 o'clock. I'd like to say thank you very much to Dr. Leung. Thank you very much to Rachel. Thank you very much, Professor Cowling. Thank you to our wonderful, wonderful audience for your fantastic questions. It's been a wonderful, wonderful session, and we are delighted to have held it. And we hope to see you at another one of PRHK's webinars in the very near future. So thank you all so much. That was really wonderful. And everybody have a great day. And let's keep our fingers crossed that vaccine hesitancy will soon be a thing of the past in Hong Kong. Thank you, everybody. Take care. Keep safe. Bye-bye.
Thanks, everyone.
Stay safe. Bye-bye.
Bye, Rachel. Bye, Tony. Bye, Ben. Thank you so much. Bye-bye.